Welcome back. I'm Mabel Jung, and you're watching Day 1 coverage of the World Healthcare Congress here in Washington, D.C. In your studio right now, we have Dr. Cindy Cooke, who's president of AANP. Hi, Dr. Cooke. How are you?
Good afternoon. I'm great. How are you?
Very well.
Good.
Thank you. So we're talking a lot about how to make healthcare better here in America and how to make it more affordable for everyone. How do nurse practitioners fit into the picture?
Well, nurse practitioners are great providers of high quality, very cost-effective health care for our patients. And that's the important thing all the way around, is high quality and cost-effective in the healthcare arena today.
Okay. Are they being utilized in the right way? And are they being included in the discussion?
We are in some of the discussions, yes. There are some states that use them very effectively in meeting the healthcare needs of our patients to have full and direct access to nurse practitioner care. Some states not so much.
Okay. And what do you think is preventing some hospital organizations from doing a better job of including nurses in the discussion and also to utilize their skill set in the hospital setting?
Well, nurse practitioners are in all settings, both in primary care and in hospital settings as well. And so it's important to have that discussion all the way around the network. So hospitals need to have the discussion of how to use nurse practitioners effectively in order to have the best utilization of their healthcare dollars.
Okay. What is your message here at the meeting this week? What do you want people to take away from what the AANP's message is?
Well, AANP continues to work on eliminating all of the barriers for nurse practitioner care. Whether it's at the federal level or at the state level, we want to eliminate all the barriers. Because at the outcome, the most important thing is the patient outcome. We would really like to see a world of health and wellness instead of away from the acute care model where it's episodic care. We really want to focus on health and wellness.
Mm-hmm. And can you outline for me some of the barriers you think exist?
At the state level, it depends on statute and regulation. Sometimes we are required to have a collaborative or a supervisory relationship with a physician in order to provide the care that we are educated and clinically trained to do. That can cause a barrier or a delay in care. It can cause an increase in cost with another copay if they have to see the physician for a particular person in order to sign a particular piece of paper, such as a Medicare patient requiring home health. If a patient is a nurse practitioner patient, that piece of paper, that referral has to be written by a physician. That's Medicare law. So we are working on that because it does increase time and money in order to access that care that they would so desperately need.
What are some of the concerns from your membership? Or what I should ask, what are some of the top ranked concerns for the membership right now during all of the changes that we're seeing in the space?
I think nurse practitioners really have patient needs at heart. And so when we see a patient who needs something that we really need to coordinate for them and to work for them, that's a concern, is to eliminate any barriers, whether it's in statute or regulation, to eliminate those barriers so that we can give the patient what they need, when they need it, at a cost-effective and high-quality manner of care.
And do you also see that there's actually a great opportunity right now because we're looking for more efficient ways of providing excellent care, and nurse practitioners could really fill the holes where there are needs?
Absolutely. There's over 205,000 nurse practitioners in the United States now, today. Over 900 million visits were made to nurse practitioners last year. And it's important to recognize the contributions that every discipline has to bring to the table. No one discipline practices independently. We all work together to the benefit of the patient. That's the most important message.
When you go to different areas, you might see an increasing number of these minute clinics. For instance, at Walmart.
Convenient care clinics.
Okay,
yes,
and CVS.
Yes.
So that's an opportunity that we see nurse practitioners really able to fill. Isn't that true?
It is. Patients are actually driving that market. because they're having a difficult time getting into their primary care. When they are sick, they need to be seen sooner rather than later in their minds.
Mm-hmm.
And so it might be, they may call their provider's office and say, we can't see you for a week.
Mm-hmm.
And they need to get better in order to go to work. And hours drive that as well. They don't want to take off from work. They want to go after work and to have it more convenient for them. And that's where the convenient care model is. Now, many of those markets work very closely with the primary care providers in their area. They refer them back, or they refer them to the appropriate level of care. Mm-hmm. So yes, nurse practitioners are meeting that need, mm-hmm. but it is patient driven.
Okay. Dr. Cooke, what are the reasons for you putting this event on your calendar? Why do you like to come to the World Healthcare Congress?
The nurse practitioners are a big player in the World Health arena, and it's important for us to listen to each other, to work together, to collaborate in how to solve some of the challenges in healthcare today. So that's why we're here.
All right. Thank you, Dr. Cooke.
Thank you very
for your
much.
time. And I'm Mabel Jong. Thanks for watching.